What's up? I'm Michael Ortiz Jr., owner of Massage Customs, massage therapist for over 13 years. And lately, I've been talking a lot about easing into the tissue and not forcing your way into the tissue. And I wanted to demonstrate exactly what I'm talking about today. I apologize. She wasn't ready for this video and she's not wearing any makeup. So, just try to ignore that for right now and just let's focus on the actual work that we're doing. So what I'm gonna do is I'm gonna just lay my hands onto her pec and just ease into that tissue. I don't wanna create any pain for her in this moment because what I don't want is for her to start to resist my pressure. I'm not saying that I'm not gonna get deep. I'm going to eventually start applying deep pressure. I'm just gonna be a lot more patient in actually getting to that deep pressure. What I want is I want the nervous system to calm down, right? And so I believe that easing into the tissue is an amazing way to do that. So let's see how it works. I first place my hand onto the client. The pressure is very, very gentle, barely even the weight of my own hand. I can't believe how many clients are already tensed up before you even lay your hands on them, as for a couple of reasons. One, they're either expecting there to be pain, so in anticipation of that pain, they're tensing up. Some people are just very guarded and they're not even realizing that they're doing it. And by just placing my hand without any pressure, you can just feel them automatically let go. And just with that little bit of pressure, you'll already see the pecs start to drop. So after I give the client a few moments to relax, I slowly start to ease in on the pressure. I ease in very slow, and I want to give the tissue and the client a lot of time to let go and relax. The moment that I feel like I'm starting to force the tissue to move, I know that I'm rushing the process. I will just tell you straight up that I do not have time to do this on every single body part. The session would take so long, so I typically do this on the main areas like the traps, the neck and shoulders if they're hurting there, or the pecs if they're having upper back pain, and so on. But to do this on every single body part is absolutely unrealistic. It would take like a 4-hour session. Anyways, before I do this with the client, I have to let them know that this isn't something that is going to but that's most likely not going to be very painful, like typical massages where we're trying to get you to that hurt so good feeling. We might get there eventually, but the getting there is going to be very just relaxing, really. With the weight of my hand, the weight of my pressure just slowly increasing. I almost don't want them to notice the change. I really feel like easing in this way actually allows the client to be able to handle more pressure than they typically can because we're slowly giving them time to adjust to it. You may not notice it yet by watching the video, but the pressure has increased and we're slowly starting to move from the sternum where I started out towards the shoulder. A lot of times when I'm doing this technique, I'll place my fingers on either side of the shoulders, the front of the shoulder, to measure which one is more forward. I will start on the one that is more forward or raised up higher when they're laying down. And just by doing this, by the end of it, 1 minute, 2 minutes, 3 minutes of applying this pressure in this way, that shoulder I'll measure again, and that shoulder will almost always be lower than the one that we didn't work on. And then I'll go even them out on the other side. Honestly, the hardest part about doing this is the fact that you must re-educate your client or explain to them how this is going to work, because we're so stuck in the no pain, no gain type of mentality that if it's not hurting, it's not working. And it just isn't true. Because by doing this, I can see some real changes in the tissue pretty fast. Will they stay that way is one thing. A lot of times we're going to have to incorporate exercises to make sure that the tissues stay where you would like them to stay, to make sure the shoulders stay back and they're not rolled forward. You're going to have to do some repatterning exercises on your own at home. But this is a great way to assist and aid in that process and to help create some long-term changes in the actual tissue. Thank you so much for watching. Check us out at massagecustoms.com.